No, you're good.
Because together we are stronger. Individually we are stronger. I remember every single phone count.
Hello, my friends. Welcome to On Point with Rachel Tourgeman. I'm so glad you can join us tonight. My friends, corporate presidents around the nation, including employees, are dealing with the ever-rising cost of healthcare insurance. As a matter of fact, employee benefits are proving to be the second biggest expense for most companies. That is why tonight I have taken the liberty of inviting Rachel Sapoznik with Sapoznik Insurance. She's the president and CEO and founder of Sapoznik Insurance. Rachel's beyond fabulous. She is recognized throughout South Florida as a leading employee benefits expert. She's recognized in national platforms like CNBC.com, Yahoo, Morningstar, Finance, MarketWatch, and also locally in the Miami Herald, like the Sun Sentinel, the South Florida Business Journal, the Daily Business Review, and the list goes on and on and on. Rachel is super fantastic. Everybody loves her nationwide. She is known to increase the employer's bottom line by keeping the cost low of the healthcare insurance, and guess what? Improving the health of employees. A win-win scenario all around. Rachel, welcome. Welcome to On Point with Rachel Tourgeman. Congratulations for so many wonderful things that you have done for the business world.
Thank you so much, Rachel. It's really quite an honor to be here with you. And the fact that we just found out that we may be related is even more fabulous.
It is fabulous. I'm excited. My daughter
very
you before.
Very excited to be here with you because, the message out there and people now are really starting to understand that taking care of yourself is so important.
It is.
And having good health care is so important. And COVID has brought so much to our attention. People that have taken care of themselves have a less likely chance of really falling victim, and I call it victim, to COVID.
I want to talk about COVID a little bit later, but right now I'm just so fascinated with you, Rachel Sapoznik. I'm so fascinated with you because I've seen you help so many employers, calling you, wanting your help, because you are an expert. And it's an honor for me to have you on this show. So we belong to a mutual admiration club. I want all our viewers, for starters, to really get to know you. How did you get inspired, if you will, to get involved in insurance? Talk to us.
It happened by accident. Most people that go into the insurance business don't really plan that mission, but I was very blessed. And I was working at a linen store, selling sheets and towels at Loman's Plaza in North Miami Beach.
I know where it's at.
There used to be a store there called Linen Chest, and I had a woman come in, and she became a customer of mine. And she said to me one day, I think you do very well in the insurance business. And she taught me something. And she taught me the importance of mentoring. And she mentored me. And she helped me understand the business. And what I realized in the insurance business is there's two tracks you could take. You could take the track of trying to really do hard sales, or you could take the track of education. And she showed me the track of education, of helping people, helping individuals. Like if you're a doctor and you just completed your residency, you need to have disability insurance, but because if God forbid something happened to you, all your medical experience may go away because you became disabled. So insurance can protect you that way. And that then continued to morph and evolve into where I am today, of really wanting to educate about your health, educate about staying healthy and how the best way you could utilize your insurance programs so that you could be, and I coined this phrase called the gift is you.
Oh, I love it.
Why is the gift you? Because when you're healthy and you're part of your family as a healthy person, you are a gift to them.
Yes, you are.
And as we take care of ourselves, that gift really becomes more and more important. And sadly, when we don't take care of ourselves, there are illnesses that we know come upon us that we have no control over. I'm not talking about that. But I'm talking about, are we a smoker? Are we abusing alcohol? Are we not taking care of ourselves by going in for our healthcare checkups?
Right.
Well, if we want to be that gift for our family, we are the most important gift, and they are the most important gift to us, then we need to take care of our health.
That's beautiful. And I'm sure that you're going to be such an amazing influence, if you will, on the thousands of viewers that are going to be watching you, because a lot of people, unfortunately, as you know, as being an employee benefits expert, they do abuse the smoking and the alcohol, and they think they're going to last forever. And like, you're right, you have to think about that you are a gift. I love the way you put that. God bless you. So getting back to Sapoznik Insurance, which is your brainchild. Congratulations. Over 30 years, right? You've been doing this.
33 years.
Wow. Oh, I love that number, 33. That's amazing. What could you tell our viewers tonight, Rachel, about the uniqueness, if you will, of Sapoznik Insurance?
Well, I feel like one of the unique parts of what we've developed is that as the CEO, as a mother, as a grandmother, as a business owner, I have a unique perspective of how business owners are handling their employees, how they're handling finances, and I can appreciate every aspect of it. I understand the employee's perspective. I understand the employer's perspective. So one of the training portions that I really speak to my staff about is I want them to treat people the way they want to be treated. So if you had a claim issue, Rachel, you would want somebody to speak to. You don't want to have to call a number that tells you to go call 1-800 and push this number and push that number. You want someone to say, Rachel, just send it over to me. I'm going to take care of it, and I'm going to call you when it's over. When it's all over, we're going to make sure that you know we took care of that claim problem.
Because we want to be pampered. We want to be nurtured. And that's what you do, Sapoznik Insurance. You know, most of us don't know anything about insurance, including myself. I got to tell you, Rachel. So you're educating me as well as all the viewers out there. So go ahead. You were telling me that you take care of everything from A to Z, apparently.
We really do. So let's say you had a child that needed a special prescription, and they have protocols. How do you know what to do? How do you know how to call the hospital or the doctors and get everything done? It becomes a stress for you. So what we do is we say, call us. Let us take that stress away and let us handle it, because we're the experts. We know exactly what the insurance companies are looking for in terms of documentation, and we know exactly what the doctors have for us, so we work together. Our role is to be your advocate. A lot of times people look at insurance people and they think that they're representing the carriers. And what I did 33 years ago is make the decision is I want to be the advocate for my clients. I want to be the representative that can speak to the insurance companies, have good relationships with the insurance companies, and be the voice so that we can help all of our clients, from CEOs to all levels of employees, have access to us. We give all of our information to all the employees that we handle. They know that they could call us. We speak different languages. So if we've got employees that speak Spanish, se puede llamar a nosotros también, podemos ayudar. If we have people that speak Creole, aussi on peut t'aider, on va parler en français.
Hey, I'm impressed.
So what we try to do is really accommodate and give that personal feeling where you know that you have a friend helping you maneuver through the very difficult world of insurance. Mm-hmm. We're that friend.
So what I'm listening really is that you really get rid of our headaches. You know, nowadays parents have to work maybe 2 jobs. You know, life is very expensive. You know, then, you know, God forbid we get sick. We need to use our insurance. But you're there to make the phone call, to lead us, to hold our hand, to nurture us, to pamper us. Sapoznik Insurance, you guys have it together.
And the funny,
go ahead.
No, I was just saying, the funny part is that sometimes, you know, we've got executives that they're very busy, and a lot of times their spouses are taking care of the insurance part of it. So we'll call the spouse and just kind of go through everything. We'll call their assistants, make sure that they're going onto the right plans. We'll take their hand and really walk them through so that they have what they need. Not what I want to sell, but what they need. And that is really the key, is to really give people choices and accommodate each person's needs. Your needs are going to be different than mine, and my needs may be different than my children's needs.
Right.
But it's about educating them and having them understand that we are flexible and can accommodate all of those needs.
Excellent. Well, we started talking a little bit about COVID-19. So now we're in the midst of this horrible situation with COVID-19. How has your business pivoted and accommodated itself to the new sense of normalcy, if you will?
Well, the pivot has been really incredible. I was very concerned when COVID first came about. We weren't sure were businesses going to go under, were employers going to not be able to afford insurance, what was really going to happen and what was going to happen to our wellness program, because we actually go out to our clients and bring wellness to them. And we chose to make a complete pivot. And so early March, when COVID first came about, by April 1st, our website had a full-blown wellness program, a virtual wellness program that I offer to anybody here. It's free.
Excellent.
There's 3 classes a day. And what we've done is we keep tweaking the classes because people are home. We've got our clients are home, but guess what? The children are home and the teenagers are home. So the virtual wellness program that you can log into, which is www.sapoznic.com, you just click in. You don't have to be a client. Anybody can click in and you'll be able to choose. Every Monday, we have a whole menu for the week, which includes things as fun as belly dancing.
Hey, that sounds like fun.
Cooking classes for nutritional.
Excellent.
We have stress. We have counselors talking about stress and dealing with different issues. We've got financial wellness because people are very concerned about their financials. So we're bringing in experts where we have these live classes. We also introduced about a month ago classes for children because the kids are home. Exactly. So we have workout classes for the parents with the kids. We have we partnered up with Eagles Haven, which is for teenagers. It's a place where teenagers can go and have their time alone with other teenagers because they can't really, because of social distancing, we can't be together. Why is it important in insurance? Why would somebody in the insurance business care about that? Well, we know that stress causes a lot of illnesses. Mm-hmm. And if we can reduce stress levels, if we can bring to your home to have access to counselors, workout, nutrition, time out for maybe your children to go online and see a program, this allows you to kind of like bring down the temperature, bring down how you're feeling, your stress levels. And we know that if we bring down stress, we bring down other illnesses. We bring down heart disease. We can bring down diabetes. We can bring down different things. And that is the holistic way of the way I've always looked at what I do. I don't sell insurance. I educate about insurance. I educate about healthcare. I educate about how do you take care of yourself.
But you've crossed all your T's and you've dotted all your I's. And you mentioned you have a holistic approach, and you really, really do. So in this situation, we're in the middle of COVID-19. What recommendations would you like to give to all our employers out there right now when it comes during these very challenging times, Rachel?
Well, one of the things that I think employers need to look at is the way they're monitoring. There's a lot of noise out there of how do we bring the employees back. Mm-hmm. And there's a lot of great information. There are companies out there, from payroll companies that have it down. They have a system where you're able to check your employees, make sure that they're not coming in with a temperature. And if they do come in with a temperature, then there is a chain reaction to get the next employee in line. So let's make sure that the employees are staying healthy. Let's make sure that they're not coming in sick. That's very important, not only from a healthcare perspective, because we don't want a chain reaction of other employees getting sick.
Exactly.
But it also makes your clients and your customers more comfortable. So for instance, let's say you have a beauty salon, or you have a nail place, or you have you're a restaurant. Your clients are going to be much more comfortable there if they know you're following the proper protocol.
Exactly.
So if you want to enhance your business, then using that proper protocol is so important.
Extremely important. So let's talk a little bit about the healthcare indicators that you so much work with, and as it relates to very high risk illnesses. And what could you tell our viewers to avoid these?
I'm going to tell you to start with the kids. I will tell you that I sit on the education board, the education fund for Dade County. And statistically, our children, 30% of our children are either borderline diabetic or diabetic. Now, these are kids in public school. This is 12th grade and below. Now, I want you to think about the geometric effect to our society if we have children that are obese and are not doing any physical activity and are borderline diabetic or diabetic. So again, I try to bring these things to the attention of parents and to the attention of our community. So one of the things that we do at the Education Fund is we build edible gardens for the kids. We go into elementary schools and we actually have them help us. We have a whole team that will go to the different schools. Right now we have about 50 or 60 schools that we have edible gardens. And what we're doing is showing kids, we show kids about nutrition. And I can't tell you how many children, unfortunately, in our community have never seen an actual carrot or an actual sweet potato or an eggplant or the different types of crops that we could grow here.
They have to learn how to eat correctly. Healthy.
Exactly. That's where it starts. If you want to talk about healthcare, we need to talk about nutrition. And then we need to talk about that for our children.
Very, very good. Let's take a couple of seconds. I want to thank all our advertisers, including you. But before we do that, I want to look at our candidates that are running for office. As you guys don't know, today, August 18th, is Tuesday primary. So we have Daniela Levine, the first one there. She's running for Miami-Dade County Mayor. We have Catherine Fernandez-Rundle. She's running again for Miami-Dade County State Attorney. We have Mike Miraval, who's running for Miami-Dade County Judge. And we have Joe Perkins, who's running for Circuit Court Judge. All of these individuals are candidates. They're outstanding. They have stellar backgrounds. You know, just make sure by now you've all voted, because either you voted in person or you voted in ballots or early voting or through the mail. So these are stellar individuals. I want to wish each and every one of them amazing luck in all of their endeavors. I'd like to also give special thanks and kudos to Jose Milton Foundation. Anna Vega Milton, we love you. Jackson Health Foundation, the best hospitals in the world. People are coming down from all kinds of walks of life to deal with Jackson Health Foundation to find the best doctors as well. We have Nicole Alvarez, who also is an attorney who deals with criminal defense, and she deals with family law. And she's amazing. You'll see her soon. And of course, we have Sapoznik Insurance. We have the pleasure and honor of interviewing Rachel Sapoznik right now. Thank you, Rachel. And of course, we have Gerardo de Broward, Miss Elaine Miseli Vasquez, who she's rescheduling the Hispanic Women of Distinction for November 20th. We love you. We have Marisol Centena, who's running right now for property appraiser. By now, you all cast in your votes. Wish her the best of luck as well. United Home Care is the best place to be at home, taking care of adults in your house. VIP Sales, Anthony D'Amato, Toyota of North Miami. Anthony, a big shout out to you. Survivors Pathway, President and CEO of Survivors Pathway, Francesco Durelli. Sexual assault, human trafficking, domestic violence, and of course, Catholic Hospice. We need to be nurtured. We need to be loving, especially when we're facing, terminal illnesses. So I want to thank all our advertisers, including you, Rachel. God bless you. Rachel, right now there's a lot of employers and presidents and CEOs of companies watching this. Why is your mid-year client review report so important for employers? Talk to us about that.
Well, we have found that a lot of employers don't really understand the claims. So claims are what drive costs. So give you an example. You have a car and your car has tires. If every time your car had a flat tire, the insurance paid for it, what would happen to your car insurance rates?
Up.
Now, you go to Publix and somebody nicks the car, nicks it. You call the insurance because you have a nick. What's going to happen to it? Car insurance is going to go up. We do the same thing with healthcare. So when we go through the mid-year review, we explain to the employers where the abuses are. So for instance, one of the biggest problems that we're having in our community is that people use the emergency room as their first line of coverage. So if they have an earache, if they have a sore throat, they forget to call the doctor, they wait till Friday, that they can't take it anymore, their ear's killing them, they go to the emergency room, and they took what would have cost a claim of $50 to about $2,500. Now think about, as an employer, you don't have one employee. You may have 100 employees. So let's say 10% of the people do that. Well, 10% of those people also have family members. So that could represent 20, 30 people going to the emergency room for non-emergency events. When you get your renewal, what do you think happens?
It goes up.
Goes up. So if we work together and you allow us to really educate your employees so that they understand they have options. So what are the options? Well, most people that have health insurance, whether it's Florida Blue, United, Aetna, Cigna, AvMed, all the insurance companies have something called telemedicine. Telemedicine is—
wait a minute, let me interrupt you because I know for a fact that you're a big proponent for telemedicine, and you had a lot to do with that getting passed, and a lot of people are using it now. So I want to congratulate you for that. Go ahead. I didn't mean to interrupt you, but I'd like to give you credit for telemedicine.
I've been working with this for a long time, and the whole idea is that imagine being able to speak to a doctor from your home, or just like I'm speaking to you. Well, there was so much resistance before COVID, because people would say, oh, well, I don't know who I'm speaking to. I don't really want to go. I don't want to really speak to a doctor on Skype. But the reality is, and you could ask your personal doctor or doctor friends of yours, 90% of all diagnosis, a doctor can determine by looking at you, speaking to you, and listening to the symptoms. They don't really need to touch you. They don't really need tests.
Well, that's great news for us because, most of us don't like to go, but we know that we need the help. We need the service. So telemedicine is trending.
It's absolutely trending. Absolutely trending. So what I do is I make sure that my clients understand that they can use their telemedicine app before they go to the emergency room. So they're able to speak to a doctor from their home. Now that claim will run about $10, $20 instead of $2,500. Huge difference. Huge. The other part is,
it doesn't matter if you're rich or poor. It doesn't matter. If you can save money, do it. Things are expensive out there. We know that, Rachel.
And we need to save money for everybody, because when the rates go up, and another thing with health insurance, when you're with an employer, we're in this together. So let's say I abuse the plan and I'm going to the emergency room all the time and I'm going constantly. When that rate increase comes up, it's not just for me. It's for you, and it's for every single person that works in that company. So because I'm not responsible, or I'm being irresponsible by overutilizing something that's not necessary, I'm infecting everybody I work with.
It's true.
And what I try to teach people is that we all have to work together. You get impacted too, because maybe now you can't afford to have your children on the plan because the rates went up so high. Maybe you can't afford to put your spouse on that plan because the rates went up so high. But if we work together and understand that we have other options, then we could bring the rates down. We can work together to bring the rates down.
It seems like you have done the whole circle of our employee benefits. No wonder they call you an expert all around our nation. That's amazing. Congratulations again, because you are also an author. A Wellness for Passion, Healthy Employees, Healthy Bottom Line. How did you get inspired to write that book, Rachel Sapoznik?
Well, I have to give credit to my older son, Isaac. We were.
I love the name.
Yep. We were sitting down one day at a convention, and there was actually a whole program about writing books. And he turned to me, he said, Mom, you have so much information about wellness. You have to write a book. So I turned to him. I never really thought about it. And I said, you know what? Okay, I'm going to do it. And I followed through. And I started to put together the whole concept of who do I want to speak to? So who do I want to speak to is business owners, CEOs. Why? Because they're the ones making decisions to have employee benefits. And if they understand how important it is to their employees, and how when an employee works for a company that cares about them, that cares about their health, loyalty goes up, production goes up. And you know what happens when loyalty and production goes up? Profits go up. So
it touches their pockets in a positive way.
Exactly. So what I wanted to do was really show, because again, I'm a business owner. Believe me, I get those bills that you have to pay every month, but I want to make sure that I'm educating my clients that those bills are actually good, because that means that you have employees. And if you have employees, you have a business. And if you have a business and you have loyal employees, guess what? You're more profitable. Exactly. And working together in that manner allows companies to really hire the best of the best.
And I agree with you. And also employees, from the employees aspect, if they're working in a place where they have somebody like you, Sapoznik Insurance, that have your insurance, you guys are carriers to them, you're taking care of their health. So they're going to be better for themselves and for their families, and they're going to be able to live longer. So it's like a win-win effect. It's a trickle-down effect. They're happy because they're healthier, thanks to Sapoznik Insurance. The employer's happy, which is your client, because his bottom line went up. And his employers are not calling in sick because you're keeping them healthy. Sapoznik Insurance is keeping them healthy. So, I mean, really big down, trickle down effect of positive in a good way all around. So,
it's funny. We do something with a lot of our clients called Biggest Loser. So this is in a way where employers give employees incentives to lose weight. And it's done in a very fun manner. There's usually financial incentives for the employees. I have a client that gives up to $3,500 for the winner of the Biggest Loser program. Wow. But I can't tell you how many letters I get or thank you notes from the employees saying, you know what, you changed my life. I don't have to take my medication for diabetes anymore. My blood pressure has come down. Well, guess what? When your diabetes medication, you don't have to take it anymore, and you don't have to have blood pressure medication, and you've now reduced your BMI, your healthcare costs come down.
And cholesterol too. I mean, it's almost like you're running everything. You're looking at everything. You're doing everything. And also, I notice about you, you're very data driven. Talk to us a little bit about that.
Well, everything is based on data. Like we live in a world right now that data is key. And it's important to really follow the trends, follow what's happening. And when we start to look at examples of people that participate and go for their wellness checkup. Right now with health insurance, it costs you $0. There is no copayment. It's covered 100% for your wellness checkup. But only 24% of people that have health insurance take advantage of it. So we look at that number and we're constantly driving people to go in for your wellness checkup so that we could increase those numbers. We look at trends. What's our smoking trend? What's our BMI trend? And how can we shift? Looking at all of these statistics helps the employer understand better how to design their plan.
I love
How do we design the plan?
As I hear you talk, Rachel Sapoznik, it reminds me of having maybe a in-service doctor and at the business just by hiring Sapoznik Insurance. I mean, I really see that. That's amazing. I want to move a little bit to your charity. You do a lot of charity, and on behalf of the thousands of people that are seeing you, that will be seeing you as the days go by, right. I want to thank you. I want to talk a little bit about the Education Fund. Tell us about your involvement with them.
I've been involved for, maybe about 10 years. I will say that I am a proud Dade County graduate. I went to elementary school at Reynolds Park Elementary School. I went to middle school at JFK in North Miami Beach, and I'm a Charger, North Miami Beach.
All right.
And the Education Fund approached me years ago, about 10 years ago, that they had an alumni program, and they asked me to be one of the honorees. I never knew anything about the Education Fund, and I found out that it is the most incredible nonprofit organization. And what we do is the following, Rachel, and you would appreciate this. Teachers right now, and let's forget COVID for right now, but teachers in our Dade County Public Schools many times have to buy their own supplies for art.
Yes.
So that the kids will have projects for the arts. And what we do is we are the fundraising arm for the teachers. So we have a warehouse with Ocean Bank where teachers could come and pick up different supplies that we have obtained at no cost. They come in there and we then take all of the supplies, and once a year we have an art, it's called the Love of Art. And these are items that were made from what they picked up at the warehouse that the children made.
Beautiful.
And these children, teenagers, and some of them are teachers, have the most beautiful art that is being made from recycled items. It becomes an auction.
That's so innovative and so creative. Congratulations on that. And also, I want to thank you, Rachel, and your partner, the Education Fund, because recently, Ileana Miranda, one of your employees, and she's fantastic. Ileana, big shout out to her.
Yeah, Ileana.
And to BB Lucky, big shout out to her too. I love your staff, by the way. Very friendly, very friendly. But you also help some members of the community, very big influencers. I call them the powerhouse. You help Global Innovative Foundation. You help Survivors Pathway and a host of other organizations that deal with us as well. And you know, they went to the Education Fund through you, because we got through you, through Leanna, through BB Lucky. And they gave away so many invaluable materials, if you will, especially now that school's starting, backpacks, paper, everything. So you're doing a fantastic job, Rachel. Let's move on to the Greater Miami Jewish Federation. You're also involved there.
I am involved. I'm involved in Federation. They have been, you know, growing up here in North Miami Beach. There's a Jewish community center called the Michael Ann Russell Jewish Community Center that when I was 18 years old, it opened up and I was a camp counselor there.
That must have been
years, and supported by the Greater Miami Jewish Federation. And about 20 years ago, there was a financial crisis. The Federation came and helped that JCC, and I'll never forget that. And I've always been a supporter of the Federation because they come and they help our community, and they help the community not only for Jewish people, but for non-Jewish people.
Beautiful.
We have a kosher food bank that we supply food for people that are suffering. I just did a joint kosher non-kosher food drive in front of my building, and working through Federation, working through Joshua's heart. We brought them together, working together so that we could feed our community. So
what a great feeling, right? That was something
that we were very very proud of, to really bring and you know, a whole idea is to break down barriers. You know, if people need food, it doesn't matter if it's kosher or not kosher, but people that need to have kosher food need help also, and people that need other type of food need help. It's a matter of bringing in and working collaboratively. In collaboration,
great heart. You have an amazing heart. Jackson Health Foundation, talk to us.
Yeah, so I've had the honor of being asked to be part of the Jackson Health Foundation. I am very proud of that because Jackson actually has a very, very special place in my heart. My son had a situation where Jackson saved him, and I will be forever indebted to them.
People travel around the world to go to their hospital.
Yeah. So, you know, we've got great leadership.
Your son is good?
Yeah, he's great. He's great. But they were fantastic. You know, shout out to Carlos Magoya. Shout out to Don Spiegelman. I mean, these guys are incredible. The doctors there are incredible. And I'm very proud to be serving on the foundation board. It's something that's very,
shout out to Charmaine, to Flavia, to Yolanda, to the whole crew. Goodwill Industries.
I love Goodwill. David Landsberg. Last year, we put a challenge up. I chaired their fundraiser.
Beautiful.
And most people don't know what Goodwill, they think Goodwill is just the stores.
Right.
And it's not. We have a huge facility in Miami where we are employing the most disabled individuals, the most. And there are companies like Badia, and I want to give a shout out to Pepe Badia for being an incredible sponsor for Goodwill. And we employ these individuals so that they have a purpose. They have a place to go in the morning. They get an income. They have purpose. And the whole idea of Goodwill is to take people from dependency to independency.
Beautiful. I love it.
Dependency to independency. And shout out to
That's a good
Romero
thing.
Brito. Romero Brito has been an incredible friend of mine. And whenever I ask him, I need your help, Romero, we got to raise $1 million. And we raised $1 million last year for Goodwill. Romero was right there with me and with the art and the different programs we put together. So we live in the most incredible community. We really do. We're
Really do.
cross sections of
But it's people like you, Sapoznik Insurance, Rachel Sapoznik, that really make a difference. And I would like to tell our viewers there's many more charities that she's involved in, but we would have to take like another 3 hours to get through all of them. But I wanted to throw out a few so that people will know is that not only do you have a great heart and an amazing acumen to save our lives through health and employers, their bottom line. So you're going from business, saving their bottom line, increasing their bottom line, and also saving our health and keeping us living longer. So you really have a 365 circle of goodness, of wellness. We thank you so much, Rachel. We're running out of time, unfortunately. I want to congratulate you again. You're a wealth of information, a wealth of resource. In reality, any employer needs your services. And any person that doesn't have insurance, whether working or not, they also need your services. Congratulations on that. Is there a last minute message?
I would like to, because there's two messages, because I think it's important.
Yes.
October is when all of the individual plans are available. So we have set up, we can help you with the individuals to see if you're able to get funding. There's money out there. There's available for the individual. Also, Medicare gets very confusing for a lot of people. And I also set up a Medicare specialist. So I want you to know that we're a resource, not only for groups and companies and CEOs, but we're also a resource for individuals. And whether it's in Spanish or English or French, we can accommodate all the languages. And I also want you to know that your good health is in your hands many times. And take care of yourself. Know that the gift is you.
Oh, I love it. I love it. You need to write another book. Suggestion, The Gift is You. I bet you it will sell like that. I know that Passion for Wellness, Healthy Employees, Healthy Bottom Line, that's on Amazon bestsellers list.
Yes.
So that's really remarkable. Well, thank you so much, Rachel. We want to have you back numerous times, talk about different things. We need to tell employers, kind of tell them all the time, you're the way to help them with their bottom line. You're the way to help them with their employees' health. Sapoznik Insurance, that's where it's at. Thank you so much, Rachel.
Thank you.
And to all our viewers, thank you so much for joining us tonight. God bless each and every one of you. Don't forget to subscribe to my YouTube channel, On Point with Rachel Tourgeman. Continue to abide by the CDC guidelines. Stay healthy and safe, and we will together get rid of this virus, because together we're stronger. God bless you all. Bye-bye for now. No, you're good.